part of my interest and passion is helping people. It always has been. It's a family trait, if you will. So learning and understanding about people as I went through my educational experiences and as a therapist, I found that it's important to help people fast. If you're suffering, you don't want to have to suffer any longer. You can tolerate it, but who wants to live a life in tolerance and just tolerating things? That's not helpful. When I personally, as a therapist, discovered EMDR, I was working with people who were victims of sexual crimes, sexual violence, and ritualistic cults, abuse in that format. So I was working with very traumatized individuals who may have been out of the trauma or may have just recently been the victim of a trauma or experienced a trauma. So I was using multisensory techniques, meaning not just sitting and talking. I would use props or chairs or the board. Some of it is taken from a theory called Gestalt. The actual approach that I used was called impact therapy. So I would use those things and it would engage them. And as I started to research in the literature more, I kept seeing EMDR in the trauma literature for obvious reasons. It's one of the most researched interventions. So I saw and found EMDR personally, and then I started to find a training, and I went to a training. Well, in the training that I went to, we had to practice EMDR with each other. So we would have to be a client as well as the therapist. And the experience I had personally was unique because I had a specific image that was disturbing to me. And through each change or set of EMDR, what happened to the image for me is it shattered into pieces and pieces would go away until it disappeared. So I thought, wow, this was interesting. So that got me interested on what's happening in the brain as well as EMDR. So as I learned and experienced and trained, I started to use it with my clients. And my clients changed so rapidly. More so than I had. I mean, they were changing rapidly with the impact therapy, but they weren't changing like this. People were changing fast. I mean, I remember one specific client who recently had a sexual perpetration, and that individual, we used EMDR. We had, I think it was 8 to 10 sessions. I don't remember the exact number. She didn't have any problems anymore. I mean, she didn't have a history of abuse. It was really one event for her. But she had struggled with this and it was just amazing before my eyes. So with that, and in my academic career, I started to look at researching EMDR. And that's really what I have done, what I do, what I will be doing, and use it as well. Because if you don't use it, you lose it. So my interest in being part of the film comes